now. So a very warm welcome to all of our audiences. Today we are graced with the presence of Prof. Dr. Victor, who will be speaking on the very interesting topic of the doctor engineer, a bridge for innovation. So I guess before we begin, it's only right for me to introduce to our audience a little bit about Prof. Dr. Victor. So Dr. Victor has been a practicing doctor since 1995 when he started his houseman. This was years before I think most of us were born anyway. So after his HO, he was posted to KK, Pengkalan Hulu. And this is actually where his interest started to flourish. So Prof. Victor is someone who likes to work with communities and has a keen interest in finding new ways of doing things. And actually, he once got an idea of a health promotion kiosk from an advertising gimmick he saw in the supermarket. And this idea actually won the Hulu Perak Health Innovative Awards back in 1999. So a year later, in 2000, he joined NPH in UM. And due to his love for a challenge, he continued with NPH OH, which was just introduced at the time. And this decision actually provided him with a great opportunity. He was accepted as a medical lecturer in UM after his graduation. And due to his continued inquisitiveness, he actually took the Masters of Engineering so that he could learn how the engineers actually think and how their mind works. And this experience has actually helped him develop innovative ideas, especially during the COVID-19 pandemic. So, Prof. Victor, thank you so much for being here with us today.
Right, thank you very much, Joe and Joel, and I'm glad I'll be here, and thank you for the invitation.
All right, thanks, Doctor. So let's get right down to the topic. So our topic today is the doctor engineer and a bridge for innovation. So it's very interesting to me. So perhaps you can share with the audience why exactly you chose this topic of the doctor engineer.
Basically, it's very simple. It's that sometimes when we are doctors, we are focused on only what we learn in medical school, and we don't look outside our borders, and we don't think beyond what we know. And most of the time, because doctors are considered the creme de creme, the medical student especially medical student from UM, the creme of the what call that. And then you basically you don't think what other people are doing, and you don't know how other people works. So it was an interesting thing to look at it from the perspective of looking at things not just from a doctor's perspective, but also from how other people think of things, and how things actually works around the world. And that is why I choose this topic. And of course, from the information that you shared just now, I did a Masters of Engineering, Safety, Health and Environment, because I want to learn basically to see how the engineers actually think, and that is quite interesting, because each of the faculty or each of the specialty in the university have actually different way of thinking in the context that we are being brought up, we are being educated, and our experience, and that actually allows me to work more closely with the engineers, especially during the COVID-19 pandemic, than just because being a doctor and then demanding that things can be done, but not understanding their limitation and what they can and cannot do. So that I think that is why the topic actually comes up.
All right, thank you so much for that, Doctor. So besides wanting to know how engineers think, were there any other perhaps intrinsic motivation that motivated you towards the engineering field? And maybe you can also share with us what have you learned? Because you mentioned, we all think differently in different fields. So perhaps what changed after that?
Yeah, basically it all started from the facts that I finished my Master of Occupational Health, Master of Public Health, Occupational Health from UM. And when after I finished and I start to go and do attachment in various organizations like ExxonMobil, Dodge, Soxo, and also other places, I found that there is, most of the time when you talk about control measures, that means how to reduce the hazard in the workplace, it comes down to engineering control. So although I am capable of understanding what's engineering control, but it's still quite difficult for me to actually discuss this with the engineers, or bring this out in a discussion that, all right, can we look at this and can we look at that in the context of occupational safety and health control measures. The engineer would look at me in the context that I'm not an engineer, I'm a doctor. What am I doing here? Why am I talking? So there was an opportunity that actually arose during that period of time when I was working here as a medical lecturer, and there was a new course coming out, which is the Masters of Engineering, Safety, Health and Environment course. So it was new, it was basically just introduced, and we are one of the, basically our faculty and our department also are contributing to the course in the context of teaching them, running one module, which basically focus on occupational health and environmental health. So during that time, is where I was toying with the idea of why can't I take this Master of Engineering, Safety, Health and Environmental course. So I applied and I got a place. Then after that, I applied for a scholarship from which they allowed, because I am basically teaching here. And if you are teaching here, you are allowed to take courses within the university if this does not disrupt your work. So the classes was in the weekend, so it was an executive course. So I got time to actually learn it. So by doing this, actually I am being more confident in when I talk to engineers. I'm being more respected because of the masters that I get. I'm also, during that period of time when I was a student, I do meet up with a lot of people working in the field, a lot of engineers, and understand their limitation, understand how they communicate and what they do. So basically, it focused on the safety and health aspect of engineering, and that actually allows me to talk in the context of what the engineers can actually do and what they actually cannot do within the scope of. You must understand that from the engineering perspective, they are all specialists when they come out. Not like us. We are generalists. We are basically a doctor, and then we go into surgery, go into internal medicine. But from an engineering perspective, they are chemical engineers, they are mechanical engineers, they are civil engineers, they are electronical engineers. So they're basically specialized in a certain field, and that basically by understanding and what each of those field actually does, it gives a better aspect of what actually people do, and you understand what people do, and that is when communication become easier. The ideal thing is that you all are doctors to come up with, and usually when we talk, and most of the time because we are doctors, we spend a lot of time in our hostel, and in your hostel is basically with doctors. It is not with other faculty, except from for year 1 and year 2, maybe you have spent time after, but year 3 and then on was you have no time to actually talk to other people, and that actually prevents you from understanding what other people are doing, what other people thoughts it, and actually that limits the experience as a university student. I think that is the issue that we face as a medical doctor, because if you look at other groups of what we call that, other groups, basically they have classes, they can take classes from other faculty, they can take classes from elsewhere, and that allows them to interact with other people. And having given the opportunity to actually do this masters allowed me to actually learn a lot of that, and also I learned the limitation that I have, and I basically learned to do and think how works is being done.
I think I really admire the way you specialize in one field, then you jump over and also learn more on the other field, the engineering side, so that you are able to contribute as much as you can to both sides. And because you understand both aspects, I think that's really admirable. So thank you for that, Prof. Prof, just wondering, as of now in there's also a field called Biomedical Engineering. So being someone who has gone through the SHE part of engineering, how would you say that differs, and what are the learning scopes, and how are they different?
Okay, so biomedical engineer is actually an engineering field, as I mentioned earlier. Engineers basically comes out in a specialist field, like civil engineer is a field, mechanical engineer. So biomedical engineer basically are focused on designing and medical equipment, and also looking at how to interact between a medical and and engineering. So that is one of the field that actually there are interaction between medical and engineers in the context that they work together in the hospital environment to design equipment to actually be able to suit and use as a hospital. So they are more into designing medical equipment in the context. So that is the biomedical engineering field. So if people who want to do medicine, who love medical field but also love engineering, I think the biomedical engineering field would be a good called undergraduate degree. So they are basically for you to actually do again if you want to do another undergraduate degree. That means a double undergraduate degree. But from my perspective, I am looking at it from a postgraduate perspective, and the postgraduate perspective because that I am doing safety and health, I'm doing occupational health. I want to learn more about occupational safety and health. So that's why I focus on masters of it. But for those people that are interested in looking at things from the designing things, to make things work, I think biomedical engineering is one of good field to combine between medical, learning about anatomy, learning about physiology, and then also learning about engineering, because they do learn about anatomy. Because without learning about anatomy and physiology, they won't be able to design equipment that basically be used inside in the one. So they do learn about what you do in the first year, second year of anatomy and physiology and how the body works. And that is what is important and what is interesting also.
All right, thanks, Prof. Yeah, it seems like biomedical engineering is pretty interesting. It's like sort of a marriage between medicine and engineering. So, yeah. So, Prof, today's topic is the doctor engineer, and the second part of the topic is the bridge for innovation. So, speaking about innovation, how do you think innovation can happen, and maybe what is needed in order for innovation to take place?
The main thing about innovation is basically you must learn to look at things from different perspective, and also you must learn to use what you already know, and apply things from other field to the current field, and also look at it from innovation in the context of because innovation can be anything. Innovation is basically you experience something and then there is no tools for you to use it. Then you say, okay, can I develop a tool for me to actually do something about it? So that is where innovation comes in. It must be something called internalization of what you do. That's why there's a lot of time people do what we call focus discussion, to look at what other people are thinking and then see whether there's innovation coming out with. But that is a way of doing it. But the best way of getting innovated is getting people with great ideas sit down and talk and then discuss and what can be done to actually solve a problem. So looking at things from a different perspective. But before you actually innovate, you need to also understand how things actually works and how things work beyond what we call beyond your medical field, beyond your understanding of medicine. So from my perspective, basically looking at it from the engineering perspective and having done Master of Engineering, and that actually allowed me to look at it and look at things a little bit different from what we have, and then but also understanding how things actually is working, especially during COVID-19. So COVID-19 is basically, we know, is a SARS-CoV-2 is a airborne virus. It is transmitted to inhalation, and then it's a respiratory virus. So that we know, and that we know very early on in 2022. So 2020. That we know already is a respiratory virus, and by knowing it's a respiratory virus, at the end of it is that this is a basic that we know, correct? When you learn from your basic, you retain what you learn from your basic, and then you use what you learn from your basic, and then you look at it from what can I do with the basic knowledge I have. That's why the basic knowledge that you have currently, that you learn, not just from medical school, but even from your secondary school, when you learn about physics, when you learn about chemistry, those are the basic knowledge that you have. And those are basically very useful moving forward. So from that perspective, I look at it. Okay, this is basically a virus that can transmit through what we call aerosol or through airborne transmission. So and then the things that how do we stop airborne transmission? How do we avoid airborne transmission? So that's why I can actually looking at it from another perspective. All right, looking at it from, let's say, when you go out to shop, when you go out to do something, and then you look at things that people do and how things actually works. I love that. I love to look at how things actually works. So I did innovation in our emergency department, where basically we put barriers, all right, around the cubicle, that we don't have that at that point of time. And because we know that this is airborne, and we know that because of the aerosol general procedure that the ED people actually does for a COVID patient, so by actually confining the what we call it, the risk within a cubicle, then it will reduce the risk for people outside who is not handling the patient. So there was, at that time, basically we started off with MCO, and all the shops are closed, and then we don't have people coming in to do renovation and things like that. So I saw there's a curtain rail up there, and also I saw there's a similar gadgets that in IKEA that actually use curtain rail to actually as a form, like a doorway. So from that perspective, I use what I learn, what I see from IKEA, I bring it back to our emergency department. I discuss with our engineers. I discuss with our to actually come out and come out with a way of basically how to confine the space. So we did that very early, and actually that is helpful in the context that it reduces the risk of people outside who start handling the patient, and that give them, and that actually prevents the transmission of COVID to the ED very, very early on. So those are something that basically, it's a very simple thing. Innovation doesn't need to be very, very big, something very new, or something very novel. But it can be using something that you have, but in a different way. So that is also called innovation.
All right, thank you so much for that wonderful explanation, Prof. So I guess internalizing what we know, understanding what we know, looking at things from a different view, and seeing how we can use that information that we already have in order to change things and to make it better. So I guess that is the recipe for innovation.
Yes.
Would you agree, Prof?
Right. Yes, I would agree. And I think from your perspective as a medical student, all right, and when you go in and see people do things, correct, you also can innovate. You can see, okay, how can I do things better from my experience? Because you all are young, you have different experience from the older people. The young people have different experience to say, can we do things differently? Can we innovate differently? Can we introduce, let's say, basically most of the time you're using app or using, can we use, maybe use what we call gaming? How can we use gaming experience into innovating? So all those things are innovation, and I think that's important, especially from young people, that can, when you go in and look at, you do learn what you learn, but you look at things, okay, is it a better way of doing things in this context? Can I do things differently? Can I use what I know? Then can I change it? I mean, you can, because that is what we encourage people to do. But you do it in a very diplomatic way, and then you would be successful. So that's what I did when I was in Klinik Kesehatan Ungkaran Hulu. I saw something being as a gimmick, and I said, okay, can we use this gimmick as a health promotion tool? So we developed a kiosk. At that point of time, there was no such innovation kiosk in in a cheap way. It's basically it will be very expensive. So basically, what I did is just get a PC, all right, develop using PowerPoint, and then develop the PowerPoint kiosk presentation, and then present it as a health promotion. So it's an interactive health promotion, and for interactive health promotion at that period of time is 1999. It's quite innovative. So you can do it, and I think it's important for you to look at things differently.
All right, thank you so much for that. It's very nice to hear that, Prof. So since most of our audience here are budding doctors, so being someone of your caliber who has both experience in medicine and engineering, what advice would you give to budding doctors out there?
I think the most important thing is to learn to love what you do. All right, and sometimes it is difficult currently to know what you love. All right, and for me, medicine wasn't my first love. All right, so this is what we call is arranged marriage, and then you learn to love it more and more. But even in arranged marriage, you can innovate and find something different. That's why I moved out from clinical practice to do public health, because I cannot envision for me to actually sit in a clinic every day for the rest of my life, looking at people coming in and giving medicine for the rest of my life, and then they don't improve in the context that they still come back to you every month, because this is a chronic disease. So that is the reason that when I was posted to Clinical Center Pekarat, I find it quite interesting and quite that working with people, working with community actually works. So for you all, as a budding medical doctor, the best thing to do now is find time to go and volunteer in organization that you love. Do things that you love to do during your weekend and during your part time, and then contribute back to society, and then you'd see whether what you are doing actually will improve how you do things, and whether it will give you a better perspective on what is nice and what is good, right? Of course, if you are interested in let's say being a cardiothoracic surgeon very very early on, that's good. That means you have an ambition already. You know what you want to do, but also keep in mind that ambition can actually change with new information, with new opportunity, and with new what we call new opportunity. In my case, it's exactly what happened, right? And my first love also is not public health. From medical perspective, I wanted to become an ophthalmologist. It's not that I did not go to ophthalmologist per se, but because I was posted in the clinical center, I find that public health is much more interesting than sitting there looking at the eye for the rest of my life. Of course, that is interesting also. I'm not saying that's not interesting, but for my perspective, because I love to go out, do other things, and work in other fields. That's why I think of doing it as doing public health, and that opportunity actually came, and it allows me to actually pursue my interest in public health. And of course, and as you mentioned earlier, that even in occupational health, it was not something I love or not something I know, and not something I learned. I did not learn this during my undergraduate education, because it was not very something very very what you call that common at the point of time. But I did learn it. I come in and I look at the opportunity, and I think it's quite interesting to have to look at a new course and to go in and explore, and exploration, and being what we call that, always trying to look at things differently. So I joined the Master of Occupational Health, although it have not been offered before in UM. So that's why I joined it, and I have no regret after that. I have basically done the best I can do, and also practice occupational health and improve occupational health in the country.
Right, thank you, Prof. That was very wholesome advice. So yeah, I think I agree with you. It's good to have an ambition, a goal, but we must also be open because ambitions can change. And I think, volunteering or, putting yourself out there, the more you experience things, then the more I guess you will find your true love and what you want. I think, yeah. So that's great advice. So, Prof, I think you are an example of a best example of a lifelong learner. So perhaps you can share your opinions on lifelong learning and how people say learning never stops until the day you die. So yeah, what is your opinion on that?
Yeah, basically, I am a lifelong learner. I learn. I look at things every time I want to do new things. And the reason I think the issue is that I cannot sit still. I cannot just do the same thing over and over again, and then being happy about it. So, lifelong learning currently is very easy, not compared to last time. Last time you need to buy books, you need to go and read a lot, and you need to basically buy a lot of books. When I started off doing web developing, I'm a web developer also. If you don't know, I did PHP development before. I did HTML before. I also do Visual Basic and some other computer programming, and that was very very early on in my career. Basically, before I did my cert, so I actually even do data D-based programming. That was way back in 1987. So it was way back there, and over the time, basically, when I want to learn something, I buy books to learn, and there is a lot of books that actually give you good guidance of how to do things. But in your time now, you don't have to do that anymore. You can just go on to the YouTube and even join some of the online learning tools that you have, and you can actually learn a lot from that. And learning things is not for you to get a certificate or not to get just a certification, but learning things also is for you to basically being happy to learn something new and being able to do something which is different from what other people do. So being a web developer myself, I manage actually 5 websites, and I develop and manage my department website. If you want to go to the department website, it's spm.um.edu.my. It's our department website. So that basically is developed and managed by me, and that is basically quite a lot of things that goes into it. And doing that and learning that, most of the time I learn from looking at how things are being done. I'm also interested in filming, so I do film editing, and I do that way back when I was in the medical school, when I edited our graduation video for my school. But currently there are so many software available that we can actually use, like DaVinci Resolve that I use actually to do editing, and all the tools, all the ways I learn from watching videos and doing it and learning how to do it. So that is what I do. But of course, beyond that, I also have another master's. I have Masters of Occupational Safety and Health, which is basically from the University of Turin in Italy, and that also is something that I treasure most. It's not the knowledge of the science of it. And for that master's, basically, I was given a scholarship, so I was very lucky. Actually, I won the scholarship. I was very lucky to get in, and University Malaya sponsored the other part of the scholarship. So I went to Italy for 3 months, which is quite a nice experience. And I was working with people from around the world. I understand what's happening around the world, especially in the context of occupational health, occupational safety and health. So the main thing is that you cannot say that you are an expert. You are an expert, correct? But there's also an expert in other fields around there. And you need to talk to people, you need to connect with people, you need to know that there's other people out there doing the similar things or doing things differently. And that connection is what makes us a human, and that is what's important in the context. So learning is basically many things many things. And there's many ways you can learn, many ways you can continue to learn and continue to do things and continue to innovate, continue to look at things so that you can actually improve on what you have done.
Thank you so much, Prof. Victor. Yeah, I think I agree with you we are experts, but it's always important to know that there are other experts, and it's very good to combine our efforts in order to bring innovation forward. So, which is in line with our event's name, which is Gathering of the Great Minds, where great minds come together to make great things. So, Prof, I really admired how you've been a lifelong learner. So, what are your aspirations and goals in the future? So, what else do you see yourself accomplishing, and what do you want to see in the future in terms of innovation?
I want to see is basically that everyone is a lifelong learner. Everyone can learn, but I also want to advise people that sometimes learning learning is for learning's sake. All right. If you do something that you love and you do something that you want to learn something, is good. It's much more happier than learning for a certificate. A lot of the time, what we do is basically we learn because we need the certificate. We need the accreditation. We need people to recognize us. That is something that is good, but it shouldn't be the only thing that you want for. You need to basically do something that you want to do, learn something that you want to learn, and that is what in the future I'm going to continue to learn. We must understand that the world does not stop. The world continue to improve, continue to innovate. Technology is changing all the time, and this technology is changing so fast that we must always keep up with the pace. Currently, the AI is so good, all right. Artificial intelligence is so good, machine learning is so good that in the future, you might not need a diagnostic capacity. The AI can do the diagnostic capacity for you. So what is the role of doctors in the future? If the doctors is just to confirm the AI, what we call that, diagnosis, that is maybe the only thing that you need to do, because everything the AI will tell you, okay, can you take this blood, take that blood, take that blood. And in the future, if you look at it, I think the most destructive issue that we have now is the self-test COVID-19. It's most destructive, and none of you might not think of it as a destructive in the context of medical field, because they can do now saliva tests for COVID-19. Imagine what they can do in the future with saliva tests. And they don't have to talk to you anymore. They just input this into a computer, and the AI is there. The AI will basically be able to tell, okay, this is what you have. Of course, that has happened already, but not in Malaysia. If you're genetic testing, right? But in Malaysia now, we have basically people are very comfortable giving their saliva, very comfortable to do saliva test. So saliva test itself is something is going to be very destructive of what you look at medical currently and what you are going to get when you come up to practice 10 years time. So I think at your level you should look at it. How to keep myself relevant when I come out.
Yeah, I think that is very sound advice. I think we need to evolve as fast as technology is evolving now. Yeah. So I guess we have come to an end of our podcast. So thank you so much for sharing all of your insights, Prof. So before we end, perhaps you have any last piece of message or advice that you'd like to give us?
Yes, basically, the main thing is that you are a medical student now. You are learning medicine. Don't forget there's a world outside, all right, of medicine, and continue to ensure that what is happening outside you understand and how actually it would affect you in the future. I think that is the best advice I can give. Because most of the time when we are in medical school, we forget what's happening outside. do spend time with people from outside your field. Do go to the university and look for other people from other faculty, other field, and then talk to them and let them, and then get more input. You will be a more wholesome person. You'll be a much better doctor. The doctor of the future is not about whether you can diagnose a disease or not. The doctor of the future is about how well you communicate with your patient. And communication is when you know how to communicate is when you learn how people think. You learn how people see from the same information that you see. So those that, and only way to get it is to connect with people outside your school. Thank you.
All right. Thank you so much. That was a wonderful message, Prof. Victor. Once again, thank you so much for your time and for being here.